All right, welcome everybody. My name is Joanette Biebesheimer, and I would like to welcome you to a very special short video about diabetes prevention and improved treatment for eye issues. And we're here with Dr. Kedar Prasad. Welcome, Dr. Prasad.
Thank you, Jeanette. Nice to be with you.
We're going to go ahead and pull up a graphic for eye issues, and why don't you walk us through some of these mechanisms of action, and
Sure.
we have some solutions. So let me pull that up real quick. All right, Dr. Prasad.
There is a fourth one which is missing, is a macular degeneration. But anyway, this is a diabetic-related eye disease, which is cataract, and also this, retinopathy, which is a glaucoma, and also the macular degeneration. So these are the main, and if you don't take care of that, it can lead to blindness. So this is very urgent to know about it. You have to know why it happens, and then we can see how we can improve the treatment, what is going on at the time. And so, for example, why it happens, why diabetes occurs, what initiates it, what factor. We have known, and we have published it, and many people support this notion that increased oxidative stress and chronic inflammation initiate the progression of diabetes and diabetic-related complications such as retinopathy. Second very important factor, which also plays important, is intestinal dysbiosis. Is equally important in terms of participating in the initiation and progression of diabetes and diabetic-related complications such as retinopathy. So the question is, if we know these things, how we can influence it to prevent it. For example, take the example of what happens in the retinopathy symptoms. For glaucoma, eye pressure increases. And then, for example, macular degeneration, you have a lot of proliferation of microvessels, and that sometimes breaks and blood comes out, and that can create all kind of problem for your eye disease. So the question is how you can handle it. So first, to reduce oxidative stress, we know we have a microdaily EMF, either capsule form, or I would suggest that if we have this kind of disease, the hydro form would be the best to take care of the oxidative stress and inflammation. The second most important thing to take care of is reversing the intestinal dysbiosis, in which, as you know, the composition of harmful bacteria increases, which produces a lot of toxic chemicals, and that contributes to the retinopathy. And so this is very important. And also that you have to know that because of the microvessels, rupture of the microvessel, how to treat them, how to prevent the proliferation of the microvessels. Well, people have used the drugs, and for example, many kind of drug they use it. But in our microdaily preparations that we have EMF, we have vitamin E succinate, and it has been shown that vitamin E succinate prevents the proliferation of the microvessels during the macular degeneration. So this is very important. Also, the pressure of the eye, glaucoma, for example. Again, all are related to oxidative stress and inflammation and intestinal dysbiosis. So if you correct them, you will improve the current treatment of the retinopathy. And so we have a microdaily EMF hydro, probiotics with prebiotics. At least two components is extremely important for prevention.
And so, Dr. Prasad, I know a few things, that you actually have a previous patent for the treatment of diabetes with micronutrients since 2009.
Yes.
And now this it's patent pending, the core 4 of the 4 products for the treatment of diabetes. But you also have a recent paper that you just published.
Yes.
And can I go ahead and pull that one up real quick so they can be able to get
Then I will explain it, because also that, for example, collagen peptides, as well as the omega-3, plays very important role when you are treating diabetes, because once you control the glucose, you will prevent the development of any diabetic-related complication because they're all related to high glucose level in your blood. So that because high glucose level in the blood also get oxidized and generates a lot of free radicals. So the first goal is how to reduce bring the hyperglycemia to a normal level of glucose.
Excellent.
Yeah, this is the paper I published. So we already discussed micronutrient mixture means micro daily EMF. In publication, you can name the product. And you can see that here is 4 things that we mentioned, micro daily EMF. We mentioned probiotics and prebiotics. But here is the omega-3 fatty acid. Suppose in case somebody has developed insulin resistance, then if you don't take care of that, then it can progress to diabetic-related neuropathy, retinopathy, nephropathy, kidney damage, all this damage. So you have to control that. So how do you do it? Well, what omega-3 is in that case unique. Omega-3 will activate directly a protein kinase B, which is also called AKT. When that gets activated, it sends a message to the glucose transporter 4, which is lying in the cytoplasm to go to the cell surface membrane. And when they go there, they allow the entry of glucose into the cell for generating energy. So this is very important. Only omega-3 fatty acid has many other functions. As you know, it is very essential fatty acid. Your body does not produce it, and you rely on a supplement or diet. So this is very important because reducing the diabetes is the first. Once you get rid of it will never develop to retinopathy. But if you have retinopathy, still it is not too late to reverse it. And then 4th one is the collagen peptides. One of the major functions of collagen peptide in case of diabetes is that when diabetes in, say, middle of a stage of the diabetes is progressing, and you have not done anything, there is an enzyme called DPP4, dipeptide. It is long name, but DPP4 enzyme, and the function of that enzyme is increases in diabetes case. This enzyme increases. What it does then, it prevents the release of insulin from the pancreas to the blood. And so then what you do, collagen peptide, there is a drug available which inhibits the DPP4 enzyme approved by the FDA, but it has also toxicity. But collagen peptide has no toxicity, and does exactly the same thing. It inhibits this DPP4 enzyme and thereby facilitates the secretion of insulin from the pancreas to the blood. So it is very, so all this core 4 is extremely important for at any stage of the diabetes. You can take it and you can prevent it further. Or say in case of retinopathy, you can improve the treatment, whatever current treatment is there, because none of the treatment that are right now available for diabetes address the main issue of increased oxidative stress and inflammation, and therefore the drug is not very effective. And also, nobody takes care of intestinal dysbiosis either, which is very central to prevention to make sure your glucose level is towards normal level. And if it is normal level, then your treatment will be very effective of retinopathy. Conventional treatment, whatever doctor is recommending it. So the central issue is reduce the glucose level, and also so that you don't develop the retinopathy. But once you developed it, then you can treat also, because there won't be any further progression. Otherwise, it can lead to blindness.
And so I have a quick question for you, Dr. Prasad, in this novel multi-micronutrient approach.
Yes.
For both the prevention.
Yes.
And improved treatment of diabetes.
Yeah.
That there are no medication contraindications.
Exactly. That's very true. The only thing I have to be careful, if you are taking a multiple oral medication or insulin, And if you combine with our approach of multi-nutritional approach, your glucose may down below 70. So you have to watch out that if it goes to below 70, then you have to contact your doctor immediately or take some kind of juice so that your glucose level is high.
Right.
Because otherwise you feel dizziness and you might faint.
And so your body is actually, it's optimized. So your blood
Yes.
sugar, and so you're being over medicated. And so it's
Right,
really
right,
important
right.
to communicate with your practitioner. And
Yeah.
for those of you that are listening, we're so grateful that you're on today. And I know your work is so important with the eyes and the work that we've done. And Dr. Prasad, I want to thank you so much for this work on diabetes, and the work that you have done is just this novel approach, because we do have patents and patent pending on all those products, but it really is the core four together. It's now
Yes.
patent pending for
Yeah.
the treatment of diabetes.
Right,
And so
right.
we wanted to thank you so much for being on today and sharing, your expertise and the solutions that we finally have available to be able to help balance that blood sugar. Thank you
Sure.
so much.
Thank you, Joanette. Bye-bye.